So interesting, so interesting. So what are the complications associated with multiple pregnancies? What would parents need to be aware of?
I mean, there are a lot of potential complications. The most complicated pregnancies are when the babies are sharing either the placenta or the sac or both. The most common, they're not very common, but the most common complications we see are they involve the amount of kind of blood flow or nutrition not being equal between the babies. So there's a syndrome called twin-to-twin transfusion syndrome. There's another syndrome called TAPS, which is twin anemia polycythemia syndrome. And there's TRAPS, which is another kind of similar syndrome. We also see selected growth restriction. So that's when one baby is growing more than the other baby. And we're really lucky that today, there's been some great research done, some of which Twins Trust has supported, into how to treat these conditions, how to diagnose and how to treat these conditions. And nowadays, parents do have access to kind of in utero surgery in some instances where doctors can use laser technology to kind of readjust the vascular structure in in utero, and it's improved kind of survival rates and the treatment of these conditions, but unfortunately, they're not always treatable. Um, pre Multiple parent or mums are more likely to have things like preeclampsia, um, other kind of typical pregnancy conditions as well. I think important to know they're also more likely to suffer from postnatal depression, postnatal anxiety. So I think it's just really important for our community to be aware that, to be on the lookout for those kinds of things and to know that they can start during pregnancy as well. So if you're feeling
Mm.
unwell or if you have any concerns, do talk to your health professional or give us a call.